Good morning, ladies and gentlemen, from Refined Skin and Body Clinic, where we assure you of being flawless. Today, we are going to be talking about a pertinent treatment called skin resurfacing, and we're going to tackle it in two angles. That is tattoo removal and scar treatments. Good morning, doctor.
Good morning. How are you?
I'm fine, thank you. Have you ever had a tattoo before?
Yes, I've got 3.
Really?
Yes.
Oh yeah, I can see one on your
is here,
hand.
yes.
I can see one on your hand. So have you ever thought of getting rid of it?
I have. No, not this one. This is my latest one, which I like.
So it's not going anywhere?
This is not going anywhere.
Okay.
There's one that I do regret. It was when I was quite young.
Okay.
And I wish I had not put it in. However,
your first crush snake?
No. It's actually my birthday sign.
Oh,
so it's nothing.
okay.
I didn't put my crush.
Okay.
But yes, it's there, and I would like to get rid of it, but I'm a bit nervous.
You're a bit nervous? So you're telling us the process is painful?
The older technology was painful. The one we're going to talk about today is less painful.
Okay.
I just have not come around to getting it done.
Oh, okay.
I will get it done soon. Maybe you can see the video of it being done.
We'd love to see the video of it getting
Yes, we'll
done.
do that.
So today we're going to talk about Pico Laser
Yes.
treatment and CO2.
Yes.
So what is Pico?
Pico laser it's a type of laser that is a picosecond. Now you've got the time, second, millisecond, nanosecond. Picosecond refers to what is called 1/1,000,000th of a second. So it's a very quick flash.
Really?
1/1,000,000th of a second.
Okay.
So that's the Pico laser. It's the new generation, relatively new generation, new for us here in Uganda, for removal of pigmentation, whether it's tattoo, hyperpigmentation from acne, melasma. So it can be used for a multitude of things. It's a picosecond laser. That's what the Pico refers to.
Okay. So how deep does it get into the skin?
Well, the depth of the treatment depends on the setting and the parameters. The Pico just refers to the time.
Okay.
So what happens with that is that first of all, for any pigmentation area, we may apply some anesthetic cream, numbing cream,
Okay.
and then we come with this laser. Now, prior to this Pico laser, we used to have it that refined the Q switch laser, which was a nanosecond. So 1/10000000th of a second rather than trillionth of a second
Okay.
for the firing of the light. It makes the sound like a photoacoustic sound. So there's like a bursting sound where the ink is being shattered,
Okay.
or the pigmentation is being shattered. Then the body absorbs that, the lymphatic system absorbs that pigmentation and gets rid of it.
Okay.
The benefit and the advantage of the Pico laser, the one we are using now, one, it requires fewer treatments.
Okay. So you have to go for a series of.
It's a series of treatment because I tell patients putting in a tattoo is cheaper and less painful than removing it. Removing a tattoo takes multiple sessions because we don't want to scar you, especially in the darker skin types, in the African skin type, for example. So we have to go gradually. We have to control the energy to avoid scarring, to avoid hyperpigmentation where the skin can go white.
Yeah.
So we have to go cautiously. It can require between 3 to 5 treatments depending on the color. So you got the dark colors, the blacks and the blues on the ink, for example, the tattoo.
Yeah.
Then you got the reds and greens, which are a bit more stubborn to treat. So they require different wavelengths.
Okay.
So in laser, when you hear us talking, we'll be talking about different wavelengths. We talk about 1064, 522, 790, whatever it is. Different wavelengths to attack different colors. Requires multiple treatments, spaced out once a month. And there's some precautions to watch out for. So the advantage of the Pico, it's less sessions compared to the traditional ones, less painful. So that's why I can consider getting it done. Less painful and less side effects or less risks, because the shooting of the laser is so quick that it doesn't damage the surrounding normal skin tissue. It just affects the pigmented area.
Okay. So are there, people can go crazy with tattoos, really. People have become so creative with tattoos and they have them on any and every body part. Are there specific body parts where that treatment can't apply?
Well, on the eye,
Because someone can have it.
you can do it. We just have to be careful. We put eye shields, for example. There is a craze in the world. I've not seen it in Uganda where people are tattooing their eyeballs and stuff.
I've seen that one on social
So
media.
I would not use it there, for example, I'm not trained enough to be able to remove tattoos on the eye, for example,
But
and I hope I don't
definitely-
see one.
Yeah.
But on any other body part, it's perfectly safe.
It's perfectly safe. Okay, so how you emphasize that this is a series of removal. How many treatments or series does someone have to come for?
So when you come in for the consultation, the first thing we'll ask you about the tattoo is how old is it? The older it is, probably
The more times you have to...
Quicker, because some of the ink is already worn off.
Oh, okay.
Number two, the darker the ink, it's easier to treat. So for example, the blacks and blues are easier to treat than the greens.
Green and red.
Third thing, is it professionally done or amateur done? Professional tattoos are deeper, all at the same depth, for example. Amateur tattoos, which you see a lot of, the ink depth is all over the place and not as deep. So those ones, amateur tattoos may go away faster, professional take a bit longer. Series of treatments, again, I said we don't want to scar you, we want the area to heal well and fade away. Like, I mean, it can be really faint. If you come very close, you may see the tattoo, but after several sessions, it's gone. I've seen patients who I anticipated 6 sessions from the traditional machine. In 2 sessions, they come back and say it's gone. Yes.
Oh, that's amazing. Okay, so we're going to go into the CO2 for scar removal. Tell us about that. How different is it from the Pico?
Pico is, it's the target is different. Like the target is the pigmentation. CO2 is carbon dioxide laser. So people think when they come to me, they're like, when I talk about laser, they're like, oh, but I don't want to get rid of my hair. There are different targets for the laser. So they could, depending on the wavelength. So for the pigmentation, we use the Pico laser. For laser hair removal, we target the melanin, different wavelength. For carbon dioxide laser, it targets the water in the skin. So you got different layers of the skin, epidermis and dermis. Epidermis is the superficial layer. And we do something called fractional carbon dioxide laser. So it affects or resurfaces the top, the epidermis. A bit penetrates down, but it's usually for the top layer to resurface the top. So we can use it for scars, acne scarring, for example. Stretch marks can be used for that to resurface the top. Any type of scarring, really. Post an accident, you've had a cesarean section and want your scar to be minimized, that's where the carbon dioxide laser comes in.
And this doesn't require a series? Just
well, it does. It requires a series, but not as many as the Pico. It depends what outcome you want to achieve. So you may need 3 or 4, 2. We did a lady recently for the scars on the face. 1 session, she's very happy. So it's really subjective. The patient decides for her, because there is a bit of downtime with the CO2 laser. This crusting of the skin as the skin heals. You have to stay indoors for a few days. It's not that you can have it done and continue with your activity. You can, but your skin will look like it's undergoing repair. And it really depends. Can you repeatedly afford to have that downtime away from work, away from your family, or are you okay with one? So this lady with one, she's very, very happy. She's much better. I think she says about 60% improvement from her scars from before.
Oh, nice.
I don't know if she'll come back for another one. She sent us a message. She's happy for us to see. You might have seen her pictures on our social media channels.
I think once the video is playing, we can also show some of the images of her before and after.
So they're very, very, very big improvement in the scarring, depending on how deep they are. Now remember, a lot of these treatments that we do, we are trying to improve. It's not to reverse or to perfect it, because sometimes once some damage has been done, it is extremely difficult to get it back to normal skin. Although we do make all efforts, and the more you do it, combination of treatments, we might use carbon dioxide laser, we perhaps will add micro needling, whether it's radio frequency or dermapen micro needling. So different modalities to affect different areas. For example, acne scarring, there are different types of scars. There's the ice pick scars, which are sharp. There are box scars that looks like boxes. Different scars require different kind of approaches. We can start with the CO2 laser. A lot of them will improve, but some of the deep ice pick scars may require additional treatments. Okay.
As we wrap up, I just wanted you to share with the viewers your 2 takes on if someone is undergoing a treatment after they've gone for either the Pico or the CO2 laser. What should their treatment be like?
See, first and foremost, what I tell patients is find a qualified provider who knows what they're doing, who have studied it. A lot of places, not only in Uganda, a lot of places, salons, spas are starting to use laser machines and having lots of issues with increasing volume of numbers. The issues come in. So first, go to a reputable provider. I've seen patients, actually I'm talking about several years ago. A patient came in after having, in town, in Kampala, they tried to remove the tattoo with hydrogen peroxide.
What?
It was really bad, and it was scarred, and it was a lot more traumatic for the patient. Recently, actually, we had somebody who tried to scrub it off with a pumice stone. I don't know how that is possible. They were told to keep scrubbing it. And someone in town, they kept going for a weekly scrub, and they tried to resurface the skin.
What?
Now, this kind of stuff damages you. So, first of all, the treatments that are there use medically approved treatments under medical supervision, provider. Our team here is experienced and trained.
Exactly.
I'm there to supervise if there's any issues or complications. So that's the first and foremost. Second thing, listen to the post-treatment care.
Yeah.
You may feel that, oh, I don't want to spend a lot of money by doing a series of treatments. Let me go and get it done in one go. Let me ask the therapist or the whoever's doing my treatment to go with high energy and clean the tattoo. You'll be back in a month with scarring and then you've got more problems.
Exactly.
So please don't try rush it. Tattoos, be sure you want it before getting it put in, because removing it is more expensive.
Yeah.
Yes, and follow the post-treatment care.
Exactly. Thank you so much, doctor, for those wise words. And viewers, like I always keep mentioning, Refined Skin and Body Clinic has these services, right,
Yes.
doctor? And the doctor has told us that he has tried all of them. So if you're looking for a reputable place to come and get these tattoos, get these scars, get pigmentation fixed, please come and visit Refined Skin and Body Clinic, where you know that you're going to be treated by a trusted professional. See you next time for another exciting topic. Be flawless.
Thank you.